Greetings and welcome. Happy summer. I'm very excited to be here with all of you today. As we get settled and members join, please take a moment to introduce yourself in the chat. Write your name, your title, the organization you represent, and a word or two that describes your thoughts and feelings around students' mental health. We will start at 11:03. It's wonderful to see people up and down the state here today. So I'd like to take a moment now and introduce to everyone here today Dr. Erica Torres. She's the Deputy Superintendent of the Strategy, Policy, and Special Projects Branch. Dr. Torres, would you like to join me over here?
Thank you so much, Dr. Sequeira. Good morning, everyone. Thank you so much for joining us today for the second session of our Senate Bill 224 Informational Webinar Series, Implementing Mental Health Education. My name is Dr. Erica Torres, Deputy Superintendent of Public Instruction for the California Department of Education. I'm so thrilled to see so many educators and partners with us today. I want to start by expressing my heartfelt gratitude for everything you do for our students, our families, our school communities. As a mom, social worker, and educator, I understand that the mental health and emotional well-being of our students are essential for their success. Senate Bill 224 represents a significant step forward in ensuring our students receive the support and education they need to thrive. Today's webinar is focused on supporting you with the implementation of mental health instruction. I would like to extend my thanks and acknowledge our colleagues and experts joining us today from the CDE's Office of School-Based Health Programs, Sonoma County Office of Education, Petaluma High School, CDE's Curriculum Frameworks and Instructional Resources Division, California Educators Together, the Orange County Office of Education, and the Children's Partnership. We designed today's webinar based on feedback that we received from our first session last month. And by the end of this session, we hope that you feel more prepared and inspired to deliver comprehensive mental health education in your schools. Thank you again for your commitment to the mental health and well-being of our students in this great state of California. It is now my pleasure to introduce our division of our Dominic Robinson, our director of our Whole Child Division. Mr. Robinson, welcome.
Thank you, Dr. Torres, and good morning, everyone. I'm Dominic Robinson, Director of the Whole Child Division here at the California Department of Education. It's an honor to welcome you all to the second webinar in our series on the implementation of SB 224. As you know, the mental and emotional well-being of our students is crucial for their success both in and out of the classroom. And Senate Bill 224 marks a significant step forward by mandating mental health instruction within health education courses for our middle and high school students. This initiative aims to equip our students with the knowledge and skills they need to navigate their mental health challenges more effectively. Over the past year, our team, alongside dedicated mental health professionals and education leaders, have worked tirelessly to develop a comprehensive plan to support this initiative. Today, you'll learn about the data on student mental health in our state, the foundational work of social emotional learning, and the resources available to you. Our goal is not just to inform, but to create a community of practice that supports our local education agencies throughout the implementation process. With that, I want to extend my heartfelt thanks to our collaboration partners and the incredible team within the Office of School-Based Health Programs. To Dr. Carrie Sequeira, your leadership and dedication have been instrumental in driving this initiative forward. Pamela, Tiffany, and the entire team, your hard work and the commitment to the mental health and well-being of our students is truly commendable. Your efforts at the program level are making a significant impact, and I'm grateful to have such a dedicated and passionate team to lead this important work. Thank you all for your invaluable contributions. Together, we're paving the way for a healthier and more resilient generation of students. Let's get started.
Thank you, Director Robinson, for the warm welcome. So my name is Carrie Sequeira, and I am the administrator of the Office of School-Based Health Programs under the Whole Child Division. I'm very, very happy to see so many LEAs present here today for our second webinar about Senate Bill 224, the expansion of mental health instruction. As we all know, the mental health and wellness has been significantly impacted as we manage a post-pandemic reality. I greatly appreciate you. I see you and all that you do for the 6 million students in California. So, the objectives today include review the statutory language on 224. We're going to do that each webinar just to make sure it really sets the context for our time together. Learn about innovative implementation strategies from a county office of health of education and school district. Provide an overview of the local textbook adoption process, review mental health curriculum resources with California educators together, share best practices for mental health instruction, and then youth advocacy groups will share their work supporting SB 224. Again, thank you all for coming today. And we are going to transition into the learning more or reminding us about the SB 224 statute language and the expansion of mental health instruction for the students in California. I would like to introduce my colleague, Pamela Cahucum, who leads the social emotional learning and mental health initiatives in her role as the school health education consultant with the California Department of Education. Pam, will you come join me up here? I don't know why I say that, but come on in.
Thank you, Carrie. Hello, everyone. So just real briefly, Senate bill was signed into 224 was signed into law October 21st. And so we are middle and high school students that offer a health course are required to provide mental health instruction. So, I also wanted to thank you all for filling out the first survey from our last webinar in May. If we can go to the next slide. And with 52 LEAs responding, we found that nearly 30% provide mental health instruction in health courses, 40% provide mental health instruction in other content courses, and over 50% of our LEAs have started SB 224 mental health instruction implementation. I think is awesome. So you also shared barriers and need for support, which were so closely related, and hands down, curriculum aligned instruction that is equity based was among the top needs. And second was training. Time, funding, and teacher readiness were common themes for areas of stretch. This week, we sent out a new survey, and I'm excited to report that we already received over 60 responses. So thank you for that. And we are here to serve you, and it is our honor to support you. I'm super happy to introduce Mary Champion with Sonoma County Office of Education. Mary Champion is a nationally certified school psychologist and licensed marriage and family therapist. She obtained her graduate level training from Cal State East Bay and has worked for the Sonoma County Office of Education since 2013. She provides bilingual direct services and supports for students and families and focuses on programming that aims to prevent suicide, support healing and resilience of students, schools, and reduce mental health stigma. Mary is a part of Sonoma County's System of Support, a network of volunteer crisis response agency that supports local schools. She served as an instructor in a teacher credential program through the North Coast School of Education and as a consultant for the grant with the North Bay Regional Center to create a statewide curriculum, Relationships Decoded, to promote healthy relationships and prevent sexual abuse of adults with developmental disabilities. Thank you, Mary, for being here.
Thank you very much for having me. I'm so happy to be here today to talk to you about our work at Sonoma County Office of Education. I'm just one member of our team that has been working very diligently on creating the Foundations of Mental Health, which is a mental health curriculum. Next slide. So what we'll talk about in our 20 minutes that I have with you all today is a little bit of the background, the inspiration around this curriculum, and most importantly, implementation and access for all that are present here. Next slide. So I want to talk a little bit about why we created Foundations of Mental Health. We were able to leverage our funds from the Mental Health Student Services Act to create this curriculum. And the reason that we did this was the predominant reason was a community need. We knew that students have been struggling with mental health and that the pandemic and various other natural disasters that hit our area specifically really exacerbated those issues. Students were in need of some more universal tier 1 interventions and supports, and educators that we worked with also were saying that they wanted to support students because those conversations were happening, but they felt like they didn't have the right resources to hold those discussions for their students. And then we were also really inspired by SB 224. This legislation really aligned with the needs that we were seeing in our own community. And then we really made sure that when we created this curriculum with the help of many folks that are also here, and we'll talk later on this call, to align this curriculum with the California Health Education Standards. We really wanted to make this as simple as possible for our educators and for our students. Next slide. And so many of you that are on this call, you are familiar with SB 224. So not only does our curriculum align with the California Health Education Standards, but it also aligns with all the mandates that are part of SB 224. So we talk a lot about the principles of mental health, making sure that students are able to recognize the signs and symptoms and know how to access help for themselves and others. We also made sure to really integrate understanding wellness and some protective factors and do a lot of work to destigmatize mental health. Next slide. So what were our priorities when we delivered or when we started to create this curriculum? We really knew that we wanted it to be accessible. We wanted educators to have something that was easy for them to access and that all students, no matter their different learning styles and abilities, would be able to benefit from. We wanted it to be user-friendly. Many of us on our team have worked in classrooms. Our team was comprised of many mental health providers that were school-based and also educators. And we knew that the easier it is to use and to read from a lesson plan, the higher likelihood that it would be used in classrooms. We also knew that it needed to be foundational and modifiable. Mental health is a huge topic, and so we knew that we wouldn't be able to cover everything, but we wanted to be able to cover the things that would really serve as a solid foundation for all educators and students. We also wanted it to be modifiable. We know that lessons can grow and change depending on the student interest and student background. So we really wanted this curriculum to be one that an educator could use as their foundation, but modify and add more to as well if that was necessary. We wanted it to be responsive to the mental health needs that we were seeing and be prepared to also be responsive to the future issues that might appear in our schools and classrooms. And most importantly, we just really understand that mental health cannot be separated from social justice issues. And so we really worked hard to ensure that this curriculum was equity-centered and anti-racist to make sure that we brought identity and other factors into the conversation of mental health. Next slide. So how did we do this? So our team, our internal team, we really started to review mental health curriculum that was available. And we really looked at most curriculums that didn't have a high cost because we know that that can be a barrier for schools. When we started to review the ones that were out there, we did find that many were lacking equity-centered and anti-racist lens, and that at times they were cumbersome to use as an educator. And so we started to really develop our own curriculum after doing this review. We were lucky enough to have support from our community. We developed a working group or an advisory panel from 37 local youth serving agencies. So what these wonderful representatives did is that we would create some drafts and we would meet multiple times during the year, and they would give us some feedback and insight so that we can continuously improve the product. We also were really grateful for guidance from the statewide SB 224 Mental Health Education Working Group that really gave us a lot of support in ensuring that the health standards were also part of our alignment in this creation. And then we also were able to leverage other funding, thanks from the CDE for the anti-bias grant, where we received consultation from On the Margins, which is a local nonprofit in our area that really focuses on liberatory practices in education. And so they provided us with some support to ensure that we really were trying to have an equity-centered and anti-racist lens. So their support really helped improve that area of the curriculum. Once we kind of got this draft developed from all of those voices, we were able to have a pilot program with 19 educators. The majority were from Sonoma County, different LEAs, and we also had some representatives from Culver City as well that joined our pilot program. And in that pilot program, the educators worked really hard to deliver and give us concrete feedback after delivering every single lesson. And we would meet and do trainings and hear all their feedback, which we were able to integrate into the more final version that we have for you today. Part of that pilot program also allowed us to have over 600 students give us feedback around their experience in receiving this curriculum. Their wonderful feedback that was very honest was very helpful in making sure that not only was our curriculum relevant for our youth, but really integrated their voice to ensure that those topics that they cared about were present. We also were able to do some modifications because we know that not one curriculum fits every shoe size. And so we were lucky to work with another local agency, Latino Service Providers. We had 2 interns that we supported to deliver this curriculum in a different format. It was in a peer-led facilitation format where they did a 2-day workshop, giving this education to their own peers. Which was a really powerful way for us to see and experience the curriculum as well. And lastly, at Sonoma County Office of Education and Alternative Education Program, we were able to integrate our curriculum with maker activities into a program called Making Wellness. And this, again, was really helpful for us to see that this curriculum can be modified and be responsive to different school community needs and still meet all the requirements that align with the health standards and SB 224. Okay, go ahead, next slide. All right, so now I'm going to talk a little bit about the overview of what is Foundations of Mental Health. Like I said before, this mental health is a huge area that we could spend a lot of time talking about, but we really wanted to design a curriculum that could be delivered in 8 lessons. So here you see all the different lesson topics that we go over. We purposely start with talking about identity because we really understand that bringing in everyone's intersectionality and different backgrounds is critical when we have a conversation around mental health. Oftentimes, mental health is really focused on the dominant culture, so we really wanted to ensure that we are bringing in lived experiences into the classroom. The first 4 lessons really kind of dive into those protective factors, thinking about what is mental health, what is stigma, how does our mind and body, how are they connected, and how does our body naturally and physiologically respond to stress. We also talk a lot about what is wellness, and there's a lot of opportunity for students in those lessons to reflect around what does wellness mean to them, to their culture, to their community, to their family. After those first 4 lessons, we dive a little bit deeper into understanding some of the more common mental health conditions that face our youth and our general population. So we dive into anxiety and depression and suicide, and then we flip the classroom a little bit and allow students to do some work where they become experts on certain mental health conditions and create that information into a gallery walk so that all the other students are able to learn from each other. And the last 2 lessons really focus on advocacy and stigma reduction, where they are able to take all their learning and apply it to a key question of what can they do to promote wellness and decrease mental health stigma in their own community. And this is where we really see the students take that learning and apply it in a way that can be meaningful for change. Okay, go ahead, next slide. So here you see a screenshot of one of our lesson plans. So all of the lessons come with visual supports and a lesson plan for the educators. Every first page of the lesson plans look exactly like this, with the objectives, the links to all the aligned standards, and some teaching notes and links to all of the materials that someone needs to deliver this. There is facilitator script and guidance for every single slide that is part of this curriculum. Next slide. Okay, and so you'll see that what we really wanted to do was to also have students start to get some protective factors by just participating. So we created some routines and rituals that can be flexible depending on the student population, but really give students a chance to build that social connection and to practice some of the grounding and coping strategies in the moment. We know that if we can increase students' coping strategies and also build up their social connection, that these can be huge protective factors for their mental health. We also wanted to make sure that multilingual learners were at the forefront of our creation. So we ensure that there's a vocabulary slide so that all of our educators can continue to follow best practices for teaching students who don't have their first language as English. Also, every single lesson always has connecting to help slides with hotline numbers and other resources, and give students ideas of what they can do outside of the classroom to continue their learning or promote the stigma reduction around mental health. Next slide. To ensure that our curriculum was inclusive of all learning styles and types, we really were intentional around the types of instructional modalities that we used. So their key question that they answer at the end as their summative evaluation really brings in artistic elements, and we leave that open to the educator to decide whether they want to do digital arts or crafting or create some poetry or other type of expression of how they would like to promote wellness and reduce stigma. Later on, I'll show some examples of some of the student work that was created. We also really wanted to tie in that civic engagement. We know that that is a really critical part for students feeling like curriculum is relevant to them. And so that's why that key question really allows for a lot of independence and creativity. There's also a lot of opportunities in the curriculum for movement, making learning fun, having some self-reflection, and also group discussions. We give a lot of guidance for the educator to decide, is this question better to do in pairs, small groups, or a whole class? And it really depends on the culture of the classroom. And then there are some videos as well to ensure that just all the different type of learning is available. We also have links for videos to have Spanish subtitles. Next slide. So we wanted to give a little sneak peek of one of the activities, just so you can kind of get a sense of what does it mean when we talk about having an equity-centered and anti-racist lens when instructing on mental health. And so what you'll see here, and I think if you do one more click, you'll see the handout. Awesome, thank you. This is one of the activities that we have students do in lesson 2, where they start to learn about what is mental health and what is stigma. And so this is a discussion where students are able to have this handout. It's linked in the lesson plan for the educator. And students are encouraged to either write, doodle, draw, bullet point, anything that they want to do an independent reflection first around the messages that they get about mental health from their home, culture, friends, or social media. We give some examples of what that might look like for students so that they can really start to reflect on what is it that they think about mental health and how has perhaps some of those messages that they've received from different sources influenced how they engage with the mental health curriculum. This activity has proven to be really helpful in connecting students, despite perhaps having different backgrounds and experiences. If we had more time today, I would encourage everyone to do this, but perhaps later when you relook at this webinar, you can come back and think for yourself and reflect on mental health for yourself, which is also a tip that we give to all the educators that participate in this and use this curriculum is that to really make sure that you have done some of this reflective work so that students can see that modeled and that you're ready to hold these conversations in the classroom. Okay, next slide. So I mentioned before that we had over 600 students give some feedback to the lesson plans. And so we wanted to share some of these statistics because this really stood out for us. And on this slide and the future slides, these are all the sample works, the summative evaluation of the students of advocating of what it means to promote wellness and decrease mental health stigma. So 74% of students reported that these lessons increased their awareness of mental health and how it impacts their life and those around them. 82% reported that these lessons increased their knowledge of mental health conditions or mental illness, including the symptoms and treatment options. And then most importantly to us as well is that 83% reported that I know how to find and access resources to support mental wellness for myself and for others. Next slide. So we were really happy with that. And we also made more changes. So our hope is that in the future, other feedback from students will even be higher than that. Again, here are some student examples that are really breathtaking and inspiring to us that they created to answer that key question of promoting wellness and reducing stigma. You can see that some students used digital work, some people just did their own artwork and words. So you can see, I'll give you a second to just look at those. Okay, next slide. Okay, so let's talk a little bit about access and implementation. So we know too that sometimes diving into a new curriculum or even new content, if you're not used to teaching this and you don't necessarily have a mental health or psychology background, we wanted to offer that support because these lessons are intended to be delivered by an educator. And of course, they can also be delivered by mental health providers at schools, but our intention was to provide enough resources and knowledge content that anyone can pick up this curriculum and do it if they're comfortable and ready. And so everyone is able to access the lesson plans and visual supports. And we also are opening up our community of practice. We'll have virtual meeting dates. This is open to anyone in the state that is interested in promoting mental health literacy. You do not have to use our curriculum to join our community of practice. But if you do use our curriculum, we would really encourage you to join this so that we can also provide you with some support and create a community of users as well. We will put that registration link in the chat in one moment. Our first meeting for that is August 29th. And so we hope to see many faces there. We also create an educator guide. And so this short guide has some tips for how to implement the lessons, and then also some resources to increase educator preparedness for some of these conversations, especially for topics that we are not used to talking about, such as suicide and depression and anxiety. Next slide. Okay, so here it is available and it's ready. It's up on our Sonoma County Office of Education website. You would be able to access it immediately by just visiting sco.org/FMH. What you see on this slide right here is a screenshot of what the homepage for that link. We do ask that you just put in your name and your email. Once you do that, you hit submit, you'll automatically receive a link to all of the curriculum and educator resources. The reason that we are having folks sign up with their email is that we see this curriculum as a living document, as a living artifact. We know that it's not perfect. We tried really hard, but we know that there are things that we can definitely do to improve. So we are hoping that through our community of practice, we'll be able to annually make updates to this curriculum. And if we make updates, we will let folks know who signed up that an update is available because the curriculum is created in Google Slides, so everything is a forced copy. So we recognize that people will download their own version and also be able to modify their own. So we'll just let everyone know if there are any updates available. And then you can always email us at fmh@sco.org if you have any questions or concerns that come up. Our team is really dedicated to this work and is ready and willing to help anyone who's wanting to support some more mental health Tier 1 interventions at their sites. Next slide. Okay. Thank you all so much.
Thank you so much, Mary. It's really impressive the work that you've done, and that community practice option that Pam dropped in the chat is actually statewide, and it'll be virtual and the dates are already set. If that's something that interests you, it definitely is a great resource. So I have the pleasure now of introducing a teacher. So Shireen Jackson is from Petaluma High School. She has taught human interactions for 10 years and English for 20 years at Petaluma High School. She attended Petaluma High School and earned her BA in English from UC Berkeley. She earned her single subject credential in English and her MS in Education Curriculum Instruction from Dominican University of California. She also has a supplemental credential in psychology. Shireen was Educator of the Year for Petaluma High School in 2022. She lives in Petaluma with her husband and their 9 and 11-year-old sons. And I'm very happy to have you here today and to really create space for teacher voice. So thank you so much, Shireen. You can join me on the screen.
Thank you. So I'm excited to talk about participating in this pilot, and I have gotten to teach the curriculum twice since I taught it once in the fall and once in the spring. So I'm going to talk about how it went both times. Next slide. So at our school, we don't have a health class, but we have a class called Human Interaction, which is health-ish. The majority of our 9th grade students take these classes. They're required classes, but some parents opt their students out because they don't want them to learn about some of the content. We have 2 human interaction teachers at our site right now, and both of the HI teachers participated in the pilot. Also at the other comprehensive site, the other comprehensive high school site in our district, both of their human interaction teachers participated in the pilot. We piloted it in the fall of 2023 and then also taught it again in spring of 2023. We also coincidentally started QPR, Question, Persuade, Refer Suicide Prevention Training through SCO for all of our 9th graders in the spring of 2023. Next slide. So I wanted to give you a little bit of context about the classes that I've taught this in. They are very diverse classes. So in my fall semester class, I had 31 students. Almost all of them were 9th graders. 7 of them were in at least one honors class. So some of them had honors English, some of them had honors biology, and some of them had both of those. I had 2 English language learners, one of whom was a newcomer. So he had a bilingual instructional assistant who was helping him most of the time when she was able to be there with translation. And I had 7 RFEP students. 4 of my students had 504s, and then I had 3 students from South County Consortium classes. So they were moderate to severely disabled students who most of their classes were just together in South County Consortium, but they had PE and maybe 1 or 2 other classes outside of that, one of which was human interaction. So one of those was a 9th grader, one was an 11th grader, and one was a 12th grader, and there was an aide to help them. I also had a full inclusion student who had a one-on-one aide and 1 other student with an IEP. So broad range. And then next slide. And then my spring semester class had 30 students. All of those were 9th graders. 5 of them were in at least one honors class. 2 of them were English language learners. One of those English language learners needed a lot of help with language, but we did not have a bilingual instructional assistant who was available. And 7 RFEP students. 4 had 504 plans, and then 10 students with IEPs, 2 of whom receive ERMS, educationally related mental health services. Next slide. So the pilot, we had 3 meetings. They were 4 to 6 p.m. each at SCO, so at our county office. And at those meetings, we were going through the lessons. Some of us during the meeting, we had already taught some of the lessons, or maybe we had taught all of them, or some people had not taught any of them yet. So as we were talking through the lessons, it was interesting to be able to hear from people, whether they had gone through it or not, on what they were thinking about how it went or how it would go, different ideas about how to adapt depending on what the class was like. Because when I taught it in the fall was different from when I taught it in the spring because my classes were different. I'll talk a little bit more about that later. And it was also just really cool to be able to network with other educators. So there were some educators in that pilot who I had worked with before, and some who I hadn't. And it was just a lot of fun getting to learn from colleagues. And so I'm really looking forward to the community of practice to be able to continue that learning. Next slide. So before we used this, like last year and years before that, we had taught some aspects of mental health. And we had also had, I always forget if it's supposed to be NAMI or NAMI, National Alliance on Mental Illness, come in to guest speak to our classes. But this gave us more options, and it also standardized our curriculum district-wide, since both of the comprehensive high schools were implementing their curriculum. So it was nice to have that standardization and also to have more information and more updated information that we were giving to our students. Next slide. Since I also teach English, I got really excited when I made this slide because the title was a rhyme, Helpful Features for Teachers. So one thing that I thought was cool, even though I don't teach a health class, it did have health education content standards in the lessons. So that's helpful for me to look against our framework for our district, because we have a human interaction framework. But also it, if you have a health class, then that would obviously be super helpful. I really like that there were forced copies of documents that allow for easy editing. So, when you click on it to open it, it makes a copy for you. So then okay, this is something that I can just edit because it's mine. And then I like that each lesson includes standardized layout. So there's an overview, why this matters, teaching notes, objectives, critical vocabulary, and then materials. And the materials section has links to all of the handouts and everything that I would need right there. Next slide. More features for teachers. So the lesson plan includes a script with options. And I really like the options because my different classes are different than each other. This year I only had one human interaction class each semester, but in other times I've had more than one. And sometimes, over the course of a day, I would teach something different in one period versus another period based on what my class is like. So I liked having that ability, like it's just built in there that there are those options. Also, it was really helpful for me when I had those students who did not have strong enough English language ability, that I actually just made a translated copy of the script in their native language and handed that to them. And I was like, this is what I'm going to be saying, like, sort of. So, because obviously I'm not just reading off of it, but it gave them more ability to follow along with what was going on because they had that. And then the lessons are broken up into a lot of different types of activities. So even though you have that that framework that's the same for each lesson, the different activities are different. So you have that basis that creates comfort, but then you also have different activities, which makes it more interesting and engaging for the students. So some examples were the gallery walk, myth versus fact, videos, discussions, the creative project. When we did the myth versus fact, the other teacher at my site did it as a Kahoot. In one of my classes, I did it as like, raise hands if you think this is a myth. And then in the other class, they were a little bit better able to handle moving around the room. And so I was like, okay, go to this side of the room if you think this is a myth. And it's just fun to be able to do that in different ways, depending on what is going to work best for the class. And even the gallery walk sometimes I could see being able to do that as a physical walk, and then sometimes just putting like pictures of it into a slideshow and saying, okay, I want you to go through the slideshow and respond to the things that you see on there. Next slide. Okay, so in the future, we're going to be continuing to teach this curriculum in our human interaction classes and participate in the community of practice. I actually hadn't signed up for it until just now, so I was excited that the link was in the chat because I just signed up for it. And our school doesn't get out until 3:20, so I just put in my little my Google form that I'll join as soon as we get out of school each day, since it starts at 3 o'clock. And of course, there's that flexibility because everyone knows that all of our teaching days are different than each other. Next slide. So my students obviously gave feedback when they did the form that went to SCO, but I didn't have that feedback. But on my final exam, one of the things that I do is ask my students, what are the top 3 valuable lessons from the entire semester? And 11 of the students in my spring class, so 11 out of 30, mentioned these lessons as one of their top 3 valuable lessons from the entire semester. And we go over a lot of different things. So that says a lot. And then I had students give some feedback about specific lessons, and these were some of the pieces on that they mentioned on our final as well. I learned and found out signs of stress that I didn't know I had. It's important. The next one is actually from a child of a mental health practitioner in our district. The reducing stigma activity let us creatively show off our knowledge and see other people's while also reducing stigma. It's valuable because you never know what someone else is going through. I feel like this is valuable because people struggle with this every day and it's really important to learn about. And I learned things that can help me to calm down / relax when I'm stressed. So I thought that was really cool, especially because it wasn't like that feedback was given right after this this unit. It was like a month or 2 later when they were thinking about the whole semester of curriculum. Those were still things that were standing out to them. Next slide. That might be the end. There we go. Thank you.
Thank you so much, Shireen. Such amazing work and great information. Your students are so lucky to have you. Next, it's my absolute pleasure to introduce our next 2 speakers, Dr. Mike Torres and Michelle Fennell. Dr. Mike Torres is the Director of Curriculum Frameworks and Instructional Resources Division at the California Department of Education, where he provides leadership to the Curriculum Frameworks Instructional Resources, the Clearinghouse for Specialized Media and Technology, and the Instructional Quality Commission, ensuring that instructional materials submitted for the State Board of Education approval are consistent with SBE adopted curriculum standards and policies. During his time at the CDE, he has been responsible for student accessibility on the California Assessment System, special education monitoring, and has served as the governor appointee to the State Rehabilitation Council. He earned his doctorate of education in educational leadership with an emphasis in educational technology. Michelle Fennell, education programs consultant, works with Dr. Mike Torres in the Curriculum Frameworks and Instructional Resources Division, specializing in the areas of health and science. Before coming to the Department of Education, she spent the first 23 years of her career working as a teacher, instructional coach, and administrator for elementary schools within the Elk Grove Unified School District. Thank you both for presenting with us today.
And thank you so much, Pam, for that introduction. And thank you to Dr. Torres and Director Robinson and the Whole Child Division for inviting us to be a part of the second webinar. Very much appreciated. So I'd like to thank all of you who have joined us today for this webinar. I'm excited to be here to share information specifically about standards, frameworks, and instructional materials adoptions at the state and local level, and how they can benefit those working to expand mental health education. Next slide, please. Much of our role in the Curriculum Frameworks and Instructional Resources Division is the development of content standards and curriculum frameworks when it's effectively tell us what students should know and be able to do within that content area. The Health Education Standards document that is visible on this slide was adopted by the State Board of Education in 2008. Frameworks provide guidance for the implementation of those standards. They tell us how the standards can be met at each of the different grade levels. Curriculum frameworks are how to implement the standards specifically in the classroom, and the audience for the frameworks include teachers, school administrators, decision makers, and also publishers of instructional materials. So they use that when creating standards-aligned instructional materials, as the frameworks outline specific criteria that the publishers must use in order to craft those materials that they intend to submit for State Board of Education for approval. The California Health Education Framework was adopted last by the State Board of Education in 2019. On the next slide, you'll see a graphic about mental health in the California Health Education Framework. It's an excellent guide in implementing the health standards. The health education content standards are divided into 6 different content areas. Mental health is truly interwoven into each of these content areas throughout the framework. In grades 9 through 12, one of the vignettes regarding mental, emotional, and social health has students chart various coping methods for stress, as well as the warning signs for a student who may be in crisis and how to support that student. Vignettes and guidance around mental health instruction occur at many grade levels. Doreen from the Orange County Department of Education will be showing you a little bit more detailed graphic later on during this webinar. I think one of the best things that the Health Education Framework does provide in guidance is guidance for creating an environment in which sensitive health topics can be discussed, which is so very important when discussing mental health. Now let's talk about instructional materials adoptions on the next slide. Once the standards and curriculum frameworks have been developed, it's time for statewide instructional materials adoptions. Many school districts look forward to an adoption of new frameworks and subsequently an adoption of new instructional materials that does typically follow. Instructional materials adoptions do occur for grades kindergarten through grade 8 at a statewide level, and are conducted and reviewed by teachers, teachers on special assignments, school administrators, and content experts. The State Board of Education then takes the reviews and the recommendations from these review panels and from the Instructional Quality Commission, who is the advisory body to the State Board, and makes a decision about which programs to approve. Schools and districts have the choice to purchase textbooks from these lists or to conduct their own review processes locally. After the adoption of the Health Education Curriculum Framework, our division put out the call to publishers with an intent to have a State Board of Education adoption of health curriculum back in 2020. When there was a lack of interest in participation from textbook publishers, it was then decided by the State Board to cancel the health education materials adoption at the state level. Keep in mind, though, there is CDE created guidance for both school districts looking for instructional materials in grades 9 through 12, as well as those looking for instructional materials in subjects that are not currently adopted by the State Board of Education, including health. Next, Michelle Fennell will be coming on board to highlight a couple of those resources, beginning with the next slide.
Thank you, Dr. Torres. So we do not have health adopted materials, as Dr. Torres said. However, we want to highlight some of the resources that we do have at the CDE regarding instructional materials adoptions. For specific to health, we have the Health Education Instructional Materials Toolkit, long name, that was written in 2021. This toolkit can assist LEAs looking to adopt health curriculum. It walks through education code as well as the health standards to support the process of finding an aligned curriculum. This can be found on the California Health Education website, which will be linked later. Also on the California Health Education website are assessment tools for LEAs who may already have a health curriculum but are looking specifically for alignment in SB 224. So this is the Mental Health Instructional Materials Assessment Toolkit. They're in grades 7, 8, and 9 through 12. This is a snip that shows in the grades 9 through 12 toolkit the language of the education code that is broken down in chart format so that LEAs can look specifically for those components within a curriculum or as well as within lessons that they're looking at to align with SB 224. Both of these, again, are found on the California Health Education website. We are also excited to highlight a new California Department of Education resource. This is the guidance. Oh, I'm sorry, we're a couple slides ahead. I'm sorry. This one right here was the Mental Health Instructional Materials Assessment Toolkit that I was just speaking to in grades 7 and 8 and 9 through 12. And then if you head to the next slide, sorry, I was missing the next slide. This is the new California Department of Education resource called the Guidance for Local Instructional Materials Adoptions that was adopted in March of 24 this year. This document is a comprehensive deep dive into the local materials adoption process for any subject matter. This document contains guidance and support for LEAs throughout the adoption process, from choosing initial materials to evaluate through the piloting process and eventual consensus, adoption, and implementation of those materials. So it truly is a deep dive and comprehensive. This document is useful for LEAs who are choosing materials on the state board approved list, as well as those seeking materials that may not be state board approved, such as health. We want to highlight just a few of the resources that are found in this comprehensive document. Next slide. California Education Code calls for the involvement of parents and other members of the community in the selection of instructional materials. The Guidance for Local Materials Adoptions document outlines ways in which parents and community members can participate throughout the instructional materials review, piloting, and selection process. The document states that parents, students, retired teachers, content experts, and other members of the broader school community can be notified and invited to participate in meetings regarding instructional materials adoptions. Participants do not need to have content expertise. They can listen to the proceedings and provide commentary or feedback at various junctures throughout the process. This guidance provides materials and suggestions on how to do that. Next slide, please. Support for English learners is also highlighted in the new guidance document. Much like the Health Instructional Materials Toolkit that we talked about earlier, this document provides charts that can be used to ensure that the materials support ELD standards. So this is a snapshot of this tool that breaks down the ELD standards. There are also tools that will help LEAs in ensuring that the materials provide support for designated and integrated ELD. Next slide, please. Like the previous English learner guidance, the guidance for local materials adoptions also includes support and tools for ensuring that instructional materials adequately support students with disabilities. This is a snapshot of Figure 8, which shows how reviewers can look through instructional materials for principles of UDL, which I know another presenter will talk about in a little bit, and take a deeper dive into how the materials support teachers in providing accommodations or modifications to the general curriculum for students with disabilities. So these are just a few of the highlights. Again, this document supports LEAs looking to adopt instructional materials in any subject and any grade level. So it can surely be used along with the previously mentioned tools to guide instructional materials adoptions in health. So I thank you for your attention. If you have any questions about the resources that Dr. Torres and I have highlighted here, please feel free to reach out to our email, which will be presented at the end of this presentation. I believe that is the end of our slides. I'll turn it back to, I believe, Pam. Thank you.
Thank you so much, Michelle. I love it. I appreciate it. It's always so informative to understand better the process for the textbook adoption, and I thank you for the resources as well. So next, I recently met this young man, and I'm excited that he is here today. This is Kyle Castleman. He is with the California Educators Together Platform Manager. He serves as an education programs consultant in the High School Innovations and Initiatives Office, College and Career Transition Division at the California Department of Education. Thank you very much, Kyle, for sharing with us today.
Thank you. It's a pleasure to be here. I know that's a tongue twister of acronyms there. But as she said, I'm Kyle Castleman. I'm the California Educators Together Platform Manager, and I have a relatively short presentation for you all today. I'm just going to share a couple of brief slides with you, talking a little bit about the California Educators Together platform, and then we'll stop sharing slides and I'll actually share my screen and go live into the platform for a few minutes, just to give you a little bit of a experience of what the platform can offer, how to use it, and what it's here for. So just to start off, if you want to go to, there you go, perfect slide. California Educators Together is the CDE's official repository of high quality instructional materials. That is a contract that I oversee through Kern County Office of Education. So we work collaboratively together to maintain, support, and develop this platform. What it's meant to be is it's meant to be a way of increasing equity and access to curriculum and other classroom resources. And it's a space for all educators. It's really meant to be a one-stop shop. So you'll see as I go through different slides and as I show you on when I share my screen, there are lesson plans, resources, other guidance, anything that we feel is valuable to educators, we try our best to get it on this platform. And when I say all educators, I mean all educators, not just teachers. It's a place for counselors, anybody from pupil services, therapists, administrators, etc. If you work in an educational setting and you need access to classroom content, this is a space meant for you. And it's not restricted to any kind of special domain. You don't have to work at a school or a county office of ed in order to be able to register and create an account. To do so, all you need to do is go to caeducatorstogether.org, or if you'd like, I put the QR code there to make it a little easier for people to get to that website with their mobile devices. But one other thing I always like to mention is that this is a collaborative space. So it really is meant to bring educators together. You could message other educators. You can see what content other educators have provided. You can join groups. There's lots that you can do in this platform. If you go to the next slide, I'm going to talk a little bit about some of the content that is on this platform. We divide up the content really in like three main buckets. The first bucket is resources. Those are classroom materials that aren't necessarily lesson plans. That could be videos, it could be handouts, guidance, other resources that are meant to support lesson plans. And then we have lesson plans, and those are actual full-fledged written lesson plans in the platform using the platform's tools so that you can use those lesson plans in your own classroom. You can keep them as is, or you can make your own one-off copy and edit it as you see fit. You can also share the lesson plans and resources you find with other educators. So that way, if you find something you like, you can let your friends know that you found a lesson plan that really helped with a specific subject. So maybe you share it with your grade level cohort or whomever you collaborate with on a regular basis. Right now, we're at about 130,000 resources on the platform and about 111,000 lesson plans. We're always working to grow that. And in the next couple of slides, I'll be talking more about how you can contribute. But before I do that, I'd like to talk specifically about the mental health education instructional materials. So if you can go to the next slide, please. Right now, if you do a search on the platform for you do a variety of search criteria. You can do social emotional learning, you can do mental health instruction, but essentially when you do a search like that, you'll find roughly 100 resources and lesson plans, which we're proud of. We are excited that we have that many classroom materials available to you all. But we also know that it's not enough. We want to get as much content as possible, especially with SB 224. We're working really hard and collaborating together to find more and more content on this platform. And so what I did here is I pulled a couple of little snippets of a couple of lesson plans that I found that seem to align as much as relatively align with SB 224. And so the screenshots you can see, this is essentially how the lesson plans lay out on the platform. And anything that you see on these little screenshots, those are all searchable features on the platform. So when you're looking for a lesson plan, you can search for things in a variety of ways. You can search by standard, you can search by keyword, you can search by grade level, subjects. And when you go into a lesson plan, it'll fully outline everything for you. It'll tell you how long the lesson plan should take. It'll tell you what students it's meant to target, what the objectives are, what the goals are. It'll tell you which ELD standards it's meant to, or which ELD standards it's using and which ELD guidelines it follows. It'll even tell you what you can and cannot share and how you can share it. It really is meant to be a comprehensive tool that allows you to use what's there and edit it as you see fit. The lessons, as you can see here, they're broken down into sections to make it easy to follow, similar to any other lesson plan format, but it starts with overviews, goes into goals and objectives. Then it talks about the resources and materials that you'll use for the lesson plan. And then it breaks it down into lesson segments and activities to guide you through providing that lesson plan to students. And then at the end, which makes sense, I think, it talks about the final assessments. And then it also has check for understandings throughout. So you have some of those formative assessments as you go through it. And like I said, you can copy and edit lessons as you see fit. But one thing I want to point out, if you are on the platform right now and you're doing a search and you're saying, hey, I don't get 100 results. Well, the reason for that is this platform is meant to be very specific to you. So when you log in and you create your profile and you answer all your questions, and then you go in and you join groups, what happens is as you join groups, you start to get access to other content. The vast majority of the content on the platform is publicly searchable without joining any groups. But there are some groups that have joined the platform and released their content to users, but they have made it to where you have to join their group before you can see their content. And so when you go through the platform and you start joining groups, you go do the same search result that you did earlier, you'll get new results. You'll get more results because now you've opened up your access to other spaces that maybe weren't readily available right off the bat. So that's just one little caveat I always like to point out, because I know sometimes I share my screen and somebody will see something and then they'll go to their screen and they're like, wait a minute, I don't see that. What's going on? And that's why. It does make it a little tricky sometimes, but it's also really powerful because it makes sure that you're getting tailored content for you and your needs based on how you set up your account. Go to the next slide, please. Like I said, we need more content. We are always building on the resources we have available on the platform. And the way we do that is a couple of ways. One is through our lesson design opportunities. We host PD for free, where after completing the PD, if you submit 3 lesson plans that get vetted, then you get a $1,500 stipend. And it doesn't require a special credential. Like I mentioned at the beginning, It's really a place for all educators. As long as you can meet the minimum requirements of what is in the lesson plan, which we guide you through during our PD, then you qualify. And assuming your lessons get vetted and uploaded, then you get the $1,500 stipend. And a couple of things that I want to mention. One is, I know when I say vetted, that adds a little bit of a barrier to whether or not you're going to get the stipend. And so one thing I always like to really assure everybody of is that A, we want the content on the platform. B, we want to help you get your content on the platform. This is a collaborative process. If for some reason you submit a lesson plan and it doesn't get approved, it's not a one and done, and now all of a sudden you don't get your content on the platform and you don't get your stipend. What it is it's a collaborative back and forth process where we say, hey, here's a couple of areas where you can level up. Here's one area where you didn't quite meet the requirements. Let us know how we can help you get it done. And we'll work with you after the PD for weeks, if not months, to make sure your content is ready for publishing. So if you're willing to commit to the process with us, we are 100% excited and willing to pay you the stipend for it. We offer 3 different types of professional development. One is a fully in-person 2-day PD. The other is a hybrid model where half the time is asynchronous prior to, and it's a 1-day in-person PD to sort of bring it all together. That's that flipped classroom style where it's a hybrid model. And then we have the fully asynchronous course where you do it all through a cohort virtually. And the reason why we've set it up with those 3 different opportunities is because we understand all educators have different ways that they like to engage in this process. Some just want to be together. They want to feel that energy in the room, and they want to be sitting next to other high-level educators that can help them level up their skills. Others, they want to do that, but don't have the time, so as much time, so they need a little bit of both. And others are like, nope, you know what? I got this. I like working in a virtual space. I'd be happy to email people when I have questions, jump into a Zoom, chat people as needed. I like the asynchronous model. So we offer both. And then before I come off the slide deck and start sharing my screen, one thing I wanted to mention is that if you've ever participated in one of our lesson design opportunities, or you're registered for one that's coming up, and you've heard that the stipend is $1,000, it's not a lie. What's happening is this, within a couple of weeks, we're going to start our new contract year. And with that, we've decided to increase the stipend to $1,500 to just show how valuable we feel educators' time is. So right now, through June, the stipend is still $1,000. But anybody who participates in any lesson design opportunities after July or starting July 1, you will get a stipend of $1,500. And then beyond that, we have lots of opportunities to get more stipends. If you want to continue the process and build out units, we pay per unit or per lesson after that point. We've even brought in guest facilitators and things like that. So we're always looking to level up what we're doing and help educators get more content on the platform. Okay, so I don't think you need to change slides yet because that would put you into the next presentation. What I need to do now is share my screen. Okay, so this is the platform. Let me get this toolbar out of the way. When you first create your account, you're gonna, like I said, you're gonna have to create your profile. And you might notice there's a lot of questions, a lot of boxes to check, a lot of things to go through. While it does take some time, that's really important because what that does is that gives you that tailored experience that I was talking about. So you select your role, you select your age, the age level of the students you support. You select what subject areas are relevant to you, all of that. And then what happens is once you've created your profile, when you go to your dashboard, you then have your tailored experience. So right now, if you log in and you look at your dashboard, it's very likely to look very different from mine. At the top here, you see we have these banners. These banners are a combination of things that everybody on the platform can see, as well as certain group members can see. So let's say you're a group member and you create a post and you want to share it. Well, if I'm a part of your group, it'll show up here. Not everybody will see it, but the people who are in your group will see it. So these are areas where we communicate across the state relevant and important information that's coming up, things that we've created, webinars that are happening, podcasts that we've just released, whatever it is. If it's worthy of a statewide announcement, we post it here. And then as you scroll through, you'll see these are the groups I've joined, the things I've favorited, resources that I have created and been working on. And so this is a very specific to me page. Yours will look very different. But beyond that, as you navigate through these top tabs, you'll see we get into the resources. This is what I was talking about earlier, where I was saying we have all the 130 plus thousand resources designed to support classroom instruction, whether it be a handout, etc. You can search for them by keyword. You can search for them by subject. And once you get into a search or you get into an area, you can then further refine down your results by saying, okay, well, I want specifically something with this kind of a content. I want something that's specifically this subject, because even though there's the main subject areas, you'll see there's also sub-subjects. So you can say, well, I don't just want all ELA. I want something specifically around writing or specifically writing process. So you can further drill down to get more and more relevant resources as you go through the filters. Same thing happens with the curriculum. The only difference is because the curriculum is required to be tied to standards to be publicly available, you also have the ability to search by standards. So you can select a standard, and then as you further drill down, it'll start to refine the lessons that are available here. And then finally, this is the section that I was talking about where you should go in and peruse the groups that are relevant to you and join all of the groups that you feel are providing information that you would like to be a part of, because not only does that change the notifications you get, the banners that you see on your dashboard, but this also gives you access to content. So if you were on the curriculum tab and you did a search for something, and then you come in and you join some of these groups, and then you go back and do that search again, you'll get more results. So I definitely encourage you to join as many groups as you see fit. When you saw on my profile, I've joined a lot of groups. You probably won't join quite as many as me, but as the platform manager, I've had to join a lot of different groups so that I can see what's happening across the platform. And then in the groups, the last thing I want to mention is that the groups are broken into 3 categories. This top section where these purpley blue buttons are, these are the big statewide subject area groups. So these are usually run by somebody at the CDE, or they're set to automatically populate content from the platform. These are fairly static groups. They don't change very much. Right here, these are the groups that do change a lot, and they're producing a lot of valuable content, like relevant new content. These are statewide initiative groups. What statewide initiative groups are groups that are run by somebody like me, an education programs consultant, a county office of ed, somebody who is charged by the CDE to lead and share content, lead the work. They've worked with me to create statewide initiative groups so that they can share their content. So you can click in here and see any one of these groups and review their content. And then finally, we have resource providers. Resource providers are not necessarily affiliated with the CDE, but they are organizations that we feel have valuable content and have been able to enter into a mutually beneficial relationship with, so that we can share their content on the platform. And so you're welcome to look through these as well. And like I said, most of these link out because they're not officially affiliated with the CDE, but they are valuable resources that we think are worth checking out. That's it. If you have any questions, you'll see at the end of this slide deck, my email is going to be listed. What I would say is, if you are an individual educator and you are planning to participate in one of our professional development opportunities, there's no need to email me. You can just go to that link I showed you in the slide deck, and you can register for a PD opportunity that works for you. However, if you're an organization that works on organizationally owned curriculum, so for example, Sonoma County, Petaluma High School, other organizations that are a part of this group, feel free to email me and we can work on a relationship to bring your content in. Maybe you would be a statewide initiative group based on whatever work you're working on, or maybe you would be a resource provider if you're not officially affiliated with the CDE. But either way, I'd like to work with organizations that have content, especially SB 224 based content, because it is an area of need on our platform. And I would love to represent your content on California Educators Together. And that's it.
Thank you so much, Kyle, for such valuable information.
Thank you.
I am so happy to welcome back our next presenter, Doreen Khatib. She is the Administrator of Health, Safety, and Prevention at the Orange County Department of Education. She also serves as the co-lead for the Curriculum and Instruction Steering Committee, Subcommittee for Health Education, advisor to the National Mental Health Literacy Collaborative, and was the project director of the statewide California Health Education Framework Rollout Project. Thank you for being here, Doreen.
Thank you, Pam. Hi, everyone. It's great to be back to continue talking about this incredibly important topic. I just want to pause here at this just introductory slide to make sure you see the logo on the top right hand corner, the California Health Education logo. I did want to mention that that logo and that group is part of the California Educators Together. So if you're perusing and you join that website and you're looking and searching for resources, please join that group, because we have really tied a lot of the resources that I'm going to be sharing today to that platform as well. And really the goal here is to be interconnected. I mean, everything that we're talking about here today in regards to mental health education, that has been a part of California health education. So as Dr. Torres has already mentioned, it is part of the standards. It is a huge part of the framework. So we do have a lot of guidance to really support high quality instruction in mental health education. And that's really my goal with my time with you all today, is just to showcase some resources around what does that mean when we say high quality health education instruction. You've already learned about wonderful resources that have been featured, and I'm so excited about Sonoma County Office of Education and the lessons that they've created. And it was just really wonderful to partner with them to really elevate that those lessons are standards based. So if you go to the next slide, I just want to say here that with health education, our big shift is really getting all of us as educators to think about health in regards to moving away from only instilling knowledge in students, like old school health education, where we sit them down and we tell them, this is what you should do, and you need to stop doing those other things. Really moving to, yes, we want knowledge, 100% important that we have essential concepts and valid, accurate, credible information, but we cannot stop there, because our goal is that we want health literate students, and that has to include skill development. And some of you have already brought this up as a part of the Q&A in regards to, well, how does this connect to other things that we're doing around building skills and competencies in students? If you go to the next slide, hopefully that image is something that you've seen before. I know if you've heard me speak, you've seen this image before, because I'm constantly putting up, but I also want to make sure that we are all centered in the fact that when we talk about high quality health education in any content, especially mental health education, because it's such an important and sensitive topic, what we're really wanting here is to think about, how does this tie to our standards? Because our standards are all skill-based. And if you, the image on the left-hand side, you'll see these are our health education content standards. The very, very bottom is essential concepts. So if we only give students information, if we only talk at them, if we only give them definitions and ask them to regurgitate information, and we stay at that very, very bottom rung of the ladder, then we're not really helping develop their health literacy. And all of the other standards are really about the application of that knowledge. Okay, great. I know some information. What am I going to do with that? And really, that is our goal. And I just put up our SEL core competencies because it is so easy to make those two connections. So if you are working with students around stigma reduction, and we're talking about language and communication and how we talk about our mental health, how do we ask for help? How do we identify a trusted adult? A lot of that is relationship skills. We're thinking about decision making and goal setting. Most of it is also self-awareness and social awareness. There is so many great connections. And when we pause and think, do my lessons build skills? That is a great space to start to ensure that we're delivering high quality mental health education. If we go to the next slide. So why does it matter that we want health literate students. We want health literate students because these are the skills that are going to also be transferable and really help support their academic achievement, but also help them in their life readiness, help them in their college career readiness. This is short-term and long-term in regards to building who they are and supporting them as human beings. So if you'll see some of the highlighted terms here, this isn't new for what we've been talking about in education and about preparing our students. We want them to be critical thinkers. We want them to be problem solvers. We want them to be self-directed. We want them to know how to communicate effectively. We want them to be responsible and productive. But there's a couple of pieces that I've underlined because to me, I feel like this bridges where health education and health services could really come together. We are doing so much on school campuses, partly before the pandemic and partly because of the pandemic, to really create a safe space in our school campuses for students to also be able to access services that are going to support their well-being and ultimately support their academic achievement. So skill-based health education, standards-based health education allows students to use information and services. That's health literacy. And it actually allows them to utilize both of those to enhance their health. And then it really helps them apply their knowledge. And I really appreciated Mary when she highlighted a few of the key components of how they structured the Sonoma County Office of Education lessons. They really thought about creating multiple opportunities for students to engage with the learning and apply what they were learning in different ways. And that's really the key that I want to emphasize. If we go to the next slide, there's a key correlation between health literacy and mental health literacy. It's literacy, right? But mental health literacy as a national definition really is looking at 4 different pillars. So if you haven't really explored mental health literacy or this is new to you, I highly recommend you explore that a little bit. It definitely aligns really nicely already with our California Health Education Standards and with the language in SB 224. Because what we're thinking is if a student is literate in their own mental health, they know how to not only foster but maintain their mental health. They understand what we're talking about when we say mental health disorders. They know signs and symptoms, but they also know options and support that's available to them, to their peers, to their families, to their community. They know how to ask for help. They know how to ask for help and they've had an opportunity to practice what that might look like. So when something happens and they do need to ask for help, it's easy for them to recall that skill that they've already developed in a safe space on a school campus, in a classroom, outside the classroom. And lastly, it's something that we keep talking about, right? Stigma. They understand what that means. They understand how to reduce stigma. And really, this is where this application extends to so many of our mental health initiatives. We are so lucky in California to have so many amazing organizations and collaborations and partnerships that bring so many initiatives not only into the classroom, but outside the classroom, extending really into that greater school community. Mentalhealthliteracy.org is a great resource, something for you to check out. I highly recommend it. You'll get access to all of the slides that have been shared today, so you'll be able to navigate all of the links that have been shared, and that'll be another resource for you to explore. Okay, so I'm going to highlight a few other resources, and then I'm going to wrap up my piece. Skills. So we talked about skills. I said the standards are the skills. I highly encourage you check out some of these resources that were developed as a part of the California Health Education Framework Rollout Project. We don't want these resources to just sit on the different websites. They are featured and shared as the California, part of the California Educators Together website on that platform, but also they are on the californiahealtheducation.org website. And really what I'm wanting to share here is that as a part of building the capacity of our educators, so if you're a director, an administrator, an assistant superintendent, if your role is to support the capacity building of your educators who are teaching health content, this is a great tool to support them in doing that. It talks about why the skill is important for every single standard that is. It models the cues. So when we talk about teach students how to analyze what's influencing their behavior, well, how do I do that? What does that look like? It actually walks the educator through those cues, and those are the cues that the educator will then help work with the students on. That is the practicing of the skill. It gives different ways that they could practice those skills. It pulls examples, just like Dr. Torres mentioned in the framework. There's so many vignettes and ideas and actual activities that teachers could be like, oh, great, I could take that and I could run with it and I could build on it. And all of those show too where those skills are reinforced in the 6 health education content areas. And the the standard guides are created based on different grade spans. So they are age appropriate. And you'll see if you look at, a K3 skill and then what it looks like for a high schooler, it's definitely more sophisticated. And that's what we want. We want repetition. And we want students to be engaged in that skill development throughout their TK-12 experience. Next slide. We also created posters that really simplify the cues for that skill development. Anyone could use these posters. You could put it up in your classroom. Our school nurses could have that be a part of the health office. Our school counselors, our school psychologists, our mental health professionals that are providing great services. This is already actually included in so many of the different counseling strategies that are skill-based as well. So it's another opportunity to really reinforce that skill development. We also created a booklet that put together by, we created one for middle school and one for high school. It really pulled all of the standard guides as well as these skill posters in one booklet. So it's just an easy to navigate. So if you teach, high school, you could download the booklet that is specific to your grade level, and it could just be easy access for you to utilize this. So you don't have to keep going back to a website, even though we encourage you to, because we're constantly updating. Next slide. I also want to highlight something again for that high quality instruction. What does it mean to deliver high quality instruction? What does it mean to have high quality instructional materials? We want to make sure that we're utilizing the framework guidance around standards-based instructional design processes. And this process, I'm not going to walk you through every single step. I just want to emphasize that this is really what we utilized in creating resources for you all, pulling that guidance from the framework. And I want to also highlight that this process takes into account assessment. How are we assessing the learning of our students? If you go to the next slide, we utilize this design process to create model learning activities. They include, obviously, they are tied to the standards, but they are also universally designed. So those are those elements, those guidelines are integrated in the design process of these model learning activities. They're also connected to SEL core competencies, and they connect to other relevant content areas outside of health. So it kind of really shows how there is a connection, an easy connection to be made between health education content and other content areas, and to really help create that health literacy and literacy across various content areas. And the left-hand side, these little icons, you'll see them throughout the model learning activities to really showcase where a UDL guideline has been utilized, or where an SEL competency is being met. So it really helps support the demonstration of how a high quality lesson, what it might look like. So if you go to the next slide, I highly encourage you, check them out. Here's one example. This one is called Finding Help for Mental Health. We actually took vignettes from the framework and we pulled them out and we fleshed them out into this lesson. And they're just an example. As Kyle said, we are all trying to build each other's capacity. I feel like health education, with the new framework and with all this legislation, it might not be a requirement, a mandate to have a health class, but we have so much health content that is mandated. So, we're really trying to galvanize all the support that's out there. Please check out these model learning activities. They're created for the different grade bands, and they're really a great resource to take and build on, and to really help support all of our capacity as educators around what it means to have high quality instruction. We also pulled out guidance from the framework around creating safe, supportive, inclusive learning environments and creating the conditions that are going to really help that skill development for students. So all of the model learning activities have like a little section on preparation. And if you go to the next slide, I want to highlight a few of those around mental health education specifically. I think, for a lot of educators, especially if it's not a credentialed health teacher that has been trained to teach mental, emotional, social health content, a lot of times people pause and say, well, I'm not qualified. Mental health education it's not clinical in nature. We take a public health approach to addressing mental, social, emotional well-being. So it means that our educators don't have to be therapists. You don't have to run group therapy in your classroom. You are focused on skill development, and that really helps. And remember, you're bridging, decreasing stigma and bridging to mental health services. So if a student needs support, you're making those connections to that support. And speaking of support, there is some content that could potentially spark or activate students that might be experiencing trauma, have experienced trauma. We don't know everything about everyone. So we want to make sure that we are prepared and create an opportunity for students to be able to say, you know what, I need to step out. You know what, I'd like to actually go talk to someone. Make that a norm. Make sure that you are preparing your environment before you jump into content. And I know the Sonoma County Office of Education Lessons do a great job of also, giving that educator support, and they do reinforce that idea. And really that is definitely something that we want to do across any content that could potentially just, arise a need in our students. So know who's available on campus that day before you start your content for a student to be able to talk to. So that is your go-to right away. If we go to the next slide, I want to also expand to know what other supports are not just available on your campus, but also in your community. We want to promote resources as another way to decrease stigma. The more we talk about, yes, we have counselors on campus if you need to talk to anyone. We have a space on campus you need to go to. Here is a list of different resources in our community that you could access, that you could share with your family, that you could share with your friends. The more we talk about that, first of all, the more likely our students are to share those resources with one another, but they're more likely to access and benefit from those resources. So do a little bit of that homework so that you also as an educator could help really promote, but help connect students as well. And then my last quick tip for you all is language matters. Our language matters. So another consideration is be mindful of how we speak about different topics, different terms. This is a really great resource. It's super easy. It's from Health Partners. It's terms to use, terms to avoid. And this could be a great activity to do with your students. So to help to build like your classroom community, this could be a great activity. And we are all learning and we are all practicing. So you as an educator, you could model like, oh, you know what? I'm actually trying not to say that. So thank you for pointing that out. Let's go back to our norms. This is a collective effort for all of us to do better. Another resource is the next slide. It's also from mentalhealthliteracy.org. I really like this resource because I think a lot of times we use some terms interchangeably, but that's not really accurate. So this is just a great visual to show like, okay, well, what are we talking about when we say a mental health illness, a mental health problem, or mental distress or no distress? So this is just one of several, great resources that you could also access to help build your capacity as an educator, but to support this also as a skill development in your students. And then last slide is a shout out to professional learning for all of us. When we rolled out the framework, and it was during the pandemic, so we shifted, instead of doing in-person professional learning, we did a lot online, which ended up being really great because we were able to build something that is still available to you all. So on the californiahealtheducation.org website, the homepage has a tab around professional learning. And these 4 courses, they have modules that are 15 minutes each. So they're very, very brief brief, straight to the point. They've pulled out the framework guidance for you. So you don't have to read 700 pages is really the goal here, is that we made it interactive. We made it so that you could pause and that you could reflect on the learning, but it also includes a lot of wonderful resources for you to explore as our professional learning is continuous. So as we are all learners in development, I urge you to check these out. For a health teacher who's teaching in a health class, these include just an introduction to the framework, but it also goes deeper in the 6 content areas. If you are charged with just teaching specific content around health education and not the full health, course with all the content areas, you're more than welcome to engage with the courses. They are also designed to be a standalone, and they focus on 2 different content areas each. I love to say this, and Dr. Torres has already said this in his presentation, but health education content, it overlaps. And there's a wonderful opportunity for us to reinforce skills that are transferable across all health content. So you'll get the link to that. And that is my last slide. Thank you so much for allowing me to be a part of this. I look forward to more webinars as we continue to learn from one another. And I'm going to hand it back to Carrie.
Doreen, thank you so much. And the information every time I interact with you or you present in front of me, I'm in awe of the information and resources. So thank you very much for sharing that with our communities, school communities. Okay, so our last presenter for today, I have the pleasure of introducing Jen Ford. She is a policy associate and supports the policy team with developing and implementing advocacy with the Children's Partnership. Advocacy strategies that engage policymakers, key stakeholders, and build coalitions around TCP's core issue areas. With academic training spanning history, public policy, and law, Jennifer brings an informed perspective shaped by over 8 years in the classroom. She is driven by a passion for social justice and improving children's well-being through thoughtful policy solutions. Jen, do you mind joining me over here?
It's afternoon. Good afternoon, everybody. Thank you for the kind introduction. I am a policy associate with the Children's Partnership and part of the coalition working towards achieving our vision of every Californian student receiving mental health education. I also come with boots on the ground experience. I taught high school in LA through COVID. So I know how much children and teenagers need mental health education. Next slide. So in 2021, our organizations co-sponsored SB 2024 with the goal of ensuring that every child in California schools has access to mental health education throughout their academic career. The mandate took effect in 2022, and the statute should include an expansion plan by January 2024. So my coalition is working towards expanding this to make sure that every child has access to mental health education. Next slide. So what we're currently working on is an issue brief to present to policymakers so that they can recognize the value of mental health education for students and understand the need for expansion. We're going to be working on highlighting best practices and help with continued implementation and getting it from K through 12 so that children are getting mental health education from the beginning and that this isn't something that they're only receiving in their later years. Next slide. So we are doing outreach to both educators and students, and I'm going to pop in the link for educators right now. We are looking for qualitative data. We are doing interviews with educators and administrators. They are going to take place over June and July and will take about 45 to 60 minutes. The feedback is anonymous unless you would like to share, and an honorarium is provided for your time. We want to talk to school staff that have implemented mental health curriculum at any grade level, elementary school, high school, middle school. Next slide. And we are also talking to former and current high school students that have had a mental health curriculum implemented and what their experience with that was. It's once again a 45 to 60-minute interview. Feedback is anonymous, and you will be given a gift card for your time. We really want to dig into what the experience is for educators and the experience for students. So we are looking for that qualitative data rather than the quantitative data, which is just as valuable, but we really want to be speaking to people that are experiencing this. Next slide. Thank you for your time. And if you have any questions about the paper that or the brief that we are writing, you can email me. My email is available. And I have given the links for both student and educators right now. If you'd like to fill it out, it's a very short survey. Thank you.
Thank you so much, Jennifer. I really appreciate that, and your time today and your history of being a teacher and really having that mindset. So appreciate that. Thank you very much. Okay. All right. So next steps. This concludes our webinar for today. We have been responding to questions throughout and posting it so everyone can see as well. We are doing an LEA survey it's a needs assessment because we need to understand what you need as far as how we can support this work or any work specific to our area and our division. So there is a survey. If you'd please take a few minutes. We are planning our webinar series, and we want to know topics of interest, what you would like to learn more about. And then as far as a fact sheet with the questions will be uploaded, and we will be sending out the slide deck at the completion of our time together today. And yeah, we're very excited and supporting all the work. I want to thank all the panelists today for everything you've done, for taking time out to present, and for all the participants. I hope everyone has a wonderful, wonderful break. If you get one, I was reminded that some people are year-round. If you have a summer break, I hope you have a wonderful time. And thank you very much for what you do to support the 6 million students in California. Bye-bye.